noticed also with the desertification, which is an issue that you were mentioning there, Helen, on the larger scale, of course, that also results in a reduced rainfall, given that trees have a positive effect on inducing rain. On a larger scale, how much that happens over a urban environment, I'm not sure, but...
Yeah. Oh, well, people pointed out that it's also very important for stormwater management.
Oh, yes, yes. Yeah, in Canberra, I think we have something like a 70% ruling in terms of the footprint that new dwellings are allowed to, and as far as I can see, most are about 90%, because I don't think they include the driveways. It's very sad. Okay, questions? Yes.
Look, your health and assessment analysis sort of looked at very much the heat effect. But of course, we've known in southwest Western Australia since 1975, well before CO2 went up, in fact, you've been in a systemic aridification, right? Your rainfall has dropped, and basically with that, the whole sort of aridification of your forests, your escarpment and what have you. And we know from Bureau of Meteorology that's going to intensify very severely over the next decade. So why is just the focus on heat rather than looking at the actual whole hydrology of southwest Western Australia, and then particularly the fire consequences in your forest, and that on air quality, but then on the whole biosystems, hydrology, sustainability of those urban environments and communities?
Yeah, thanks for the question. I mean, the first point to make, I guess, is that it was a health impact assessment, so it really focused predominantly on how it would affect health, particularly in terms of mortality and morbidity and lifestyle. So when we conducted the impact assessment with the 3 local governments, heat basically came out as the highest level of risk. So I then selected to move forward with that. I guess I couldn't actually cover all the different health impacts because I just didn't have the capacity to do it. But one of the things that did come up in the health impact assessment was the impact, potential impact of bushfires on air quality. So we did look at that in the early stages of the assessment, but we just didn't continue it through in the systems thinking part of the project.
Yes, thanks. What we tried to do was to take heat and use that in a systems approach to see how it would work. And then, as it seems to have yielded some quite interesting results, then to have used that same process for ozone and then for air quality and so on and so on. It was really investigating use of systems thinking within the HIA process to see how it could be applied. So it wasn't necessarily about heat itself, just heat came out highest in the risk assessment part of the process.
Did you look at all with the trees of the changing environment that there are possibilities of success and thriving and actually growing up to produce shade for the humans? I mean, that's definitely part of, I guess, the continued management dealing with the stresses of climate change in urban environments. And there's people in the horticultural industry who are looking at that, who are looking at growing appropriate trees, so trees that are drought resistant, and trees that can actually withstand the other stresses of urban environments such as higher air pollutant levels. So that's all part of, I guess there's a saying which is right place, right tree, right reason. So it's part of making sure we select the right trees for, particularly in WA, for a drying climate and a hotter climate. So yeah, most definitely.
Just a quick question or comment. Peter Atkins, the Major Cities Unit. Thanks for the presentation. It's really terrific stuff. As a planner of 30 years, I see the parallels with the way in which environment wasn't considered in planning and development processes back in the 60s and 70s. And heritage, believe it or not, wasn't considered back in the 60s and 70s. But the framework work of HIA is a direct parallel to environmental impact assessment, and the sorts of debates we're having now are just perfect for the forums of strategic state, metropolitan and local planning. If you take the parallel with environment coming into the planning sphere as a public forum to debate these issues, there wasn't an advocate for the environment, So all planning systems in Australia were made to consider the environment. Health is a very powerful social objective, and it has very powerful state and local responsible agencies, so they must be engaged in the institutional processes to push forward these discussions and to deal with the perverse outcomes that you were referring to earlier in the feedback loops with health, the urbanisation processes destroying fresh food at the periphery of our cities, all these quite strong processes. Another comment I'd make is that the cities themselves are changing. They're not neutral. And some of the work that we're doing nationally shows that our cities are socially stratifying and that there will be equity and health issues. We know that there's a concentration of health problems in our outer areas. It's not necessarily because of urban form. It's because housing markets are dictating that young people go to the fringes of our cities and they aren't able to move because house prices have skyrocketed in the last 10 to 15 years. So the changing nature of our city needs to come into the compounding issues around health, whether it's access to food, urbanising edges of our cities, destroying our peri-urban agriculture, and the way in which communities of low economic status are being concentrated at the periphery of our cities. So the changing nature of our city, I think, is another dimension to be brought into the urban health policy push.
I guess a lot of the talk today has been about dealing with some of the problems of past urban planning decisions, particularly urban sprawl, so some of the unintended consequences, and Annie spoke about a lot of them. And I think we just have to make sure that we're not sitting here in 40 or 50 years' time talking about the mistakes we made with urban consolidation, that we start thinking about those unintended consequences in advance and doing something about them.
Okay, now time detects that we need to cut it out there. So thank you very much, and if you join me in thanking both Jeff, Katrina, and Helen, and also Sharon, Martin, and Jen.